Most common injuries facing road runners is the so-called iliotibial band friction syndrome, an injury that affects the runner's knee and can keep you out of action for months and even years. To get his advice on this for our viewers, we came to a well-known Johannesburg physiotherapist. Gary, how do you know that you've got iliotibial band syndrome, and what do you do about it?
Ian, iliotibial band friction syndrome is one of the most common beginner running injuries that we see in the novice, normally within his first year or two of running. And actually it's a very long name for a very small area of pain. And that pain is a very specific spot on the outside of the knee. And it gets its name from the fact that this band runs from the ilium up in the hip, all the way down the outside of the leg to below the knee into the shin bone, the tibia. And just at this point, there's a bone sticking out called the epicondyle of the knee, and this band lies next to it like that. And as you run, at the last 30 degrees of movement, it flips up and down, giving you a friction effect. And with overuse, this tends to get inflamed and become painful, and that's when you get the pain on the outside.
What does a runner have to do to prevent getting this injury?
As I mentioned, it's really an overuse type of injury, and you need to set realistic goals and make sure that you progress slowly towards those goals. Secondly, I think you need to get your feet examined when you start out running to make sure that you have the correct shoe to suit your foot type. And thirdly, to do a set of lateral stretching exercises to maintain the flexibility of that band.
Now, Gary, if we have this problem, what is the best way to treat it?
I believe that the conservative approach tends to get about 90% of the people better. That it would include physiotherapy modalities such as ultrasound and interferential to help with the inflammation and the swelling. And secondly, there's a lot that the runner himself can do, such as doing the lateral stretching exercises on a regular basis, building up slowly, applying ice packs to bring down the inflammation, avoiding downhill running, trying to keep on a flat surface, and initially he needs rest and then a slow build-up.
And what about cortisone injections?
I believe that for the very small percentage of people that the conservative method doesn't help, cortisone and an injection and a snip, an actual operation, can actually help.
But that's the last resort, would you say?
It should definitely be used as the last resort.
So if you do have pain on the outside of your knee, don't despair. Help is available. But just remember, prevention is better than cure.